Hello, Emma. I'm so excited to have you join. I would love it if you would give yourself a little introduction and tell us who you are and what you do.
Yeah, so my name is Emma Jack. I'm a physiotherapist by training, and have my own clinic here in London, Ontario called Press Play Physiotherapy and Pilates. But majority of the work I actually do now is with typically women in the health and wellness industry, helping them get the most and feel the most fulfilled in their careers, but also more importantly in their lives. And that was really born out of a experience myself, working in healthcare with deep burnout and trying to figure out, oh my gosh, I feel so pulled to, help people feel good in their lives. And here I am feeling absolutely terrible in mine. And it's something that I see is so common with people in sort of, I think the service industry in general, but also like more deeply in health and wellness. And so I feel so fulfilled now being able to help other people across that bridge faster, easier, with more fun, than when I was in that and trying to claw my way out of it.
It's so backwards, eh? Like I literally just had this conversation with another client where she's like, "I'm so sorry, I'm just exhausted. I can't make my session." And I'm like, "Yes, good for you. Like I super appreciate that. And, like thank you for honoring your body, blah blah blah." And then
Yeah.
there was one day where like she came in, she's like, "Are you feeling okay?" She's like, "I don't mean it in a disrespectful way. I'm just like checking in." I'm like, "I'm
Yeah.
exhausted." And she's like, "You should have
Yeah.
canceled." And I'm just like, that thought didn't even cross my mind. But thank you. So I've
Yeah.
gotten better over the years of like that practice what you preach sort of thing. But it is, I see so many other people, like you said, in the health and wellness industry that are not necessarily honoring what they would encourage their patient to do.
Totally, totally. We are a do as I say, not as I do industry. And I think it does come from such a loving place. Like, I
Yeah.
think its roots are coming from such a good place. It's just sort of been maladapted, over time, where, yeah, we don't consider ourselves near as much as we would consider other people. And so, to be able to shed light on that, bring light to that, and help people work with that tendency, has been so beautiful.
When I first started, I remember if I would take a week off, I would like pre-record workout sessions to send to my clients. And like I say you and I were kind of chatting before we hit record
Yeah.
at one of the osteo clinics, and the guy who owns it was very therapeutic in that way of he's like, with all due respect, he's like, your job is great, you're fabulous. He's like, it's not that important.
Yes.
They can go for a walk if you take a week off. And it was the first time where I'm like, yeah, like I'm so grateful that people love what I do and that I'm able to help people, but I'm not a brain surgeon and people
Yeah.
don't need me for a week.
Exactly. It can be this sense of over
Yes.
responsibility, for other people that we let get in the way. And isn't it funny how like the stories we tell ourselves,
Yes.
oh, I couldn't possibly take a week off, or I know I told myself I couldn't possibly take a month or 6 weeks off at a time. And like, guess what? People are fine. So it's a really important lesson. And like you said, it's all keeping it in perspective. The work, everyone does is so important. And nothing crumbles if it really, what happens is it does crumble if we let ourselves get to the point where we can't or don't want to do it at all anymore,
Yes.
right? That's where people are really left. So, I always think anything you do in service to you as a leader, as a business owner, as a practitioner, is in service of your people. Because the better you can show up and the better energy you have and the more vibrancy you have, the better they will be served. And so, all of that stuff is in service to not only yourself, but everyone else.
And I think this kind of leads into what I wanted to chat about next too. But I think like when you find your right people, like I've had some clients that have been with me for 13 years, have followed
Wow.
6 different locations, 6 different names. Like I
Yeah.
multiple surgery breaks in there for myself, and like then
Yeah.
with COVID, like, and
Yeah.
you're all still sticking around, and like I acknowledge that that is not necessarily normal for a lot of practitioners, but I'm so grateful that that's the norm for me. And
Yeah.
it's, yeah, it's when you find the right people, they're just like, yeah, I'll be there. You want to take a few weeks
Yeah.
off? That's cool. See you at the end.
Yes, exactly. I think the community we build is such a reflection of the boundaries we hold.
Yes.
And so that's such a good example.
And then I love, so you and I kind of both did the like hopping around working for other people initially, building our own like storefront practice, and then discovering that working from home is really, really lovely.
Yes.
So with all of those like kind of leaps of faith in business and in personal life too, how have you approached making those big decisions and those big life changes?
Yeah, I think I would harken back to kind of the conversation we just had of like what will allow me to show up the best for my people.
Mhm.
And I, sort of, if I look back at my story and sort of the journey, career journey I've been on, sort of early on, I checked all the boxes. Like I did everything that sort of society would deem as successful and it was full of achievement. I in 2017 I started my own practice and, had my own brick and mortar location and grew that location to multiple practitioners. And so it's sort of like on the outside looking in, that would be like what is deemed as successful. And it was very successful. And I just remembered not feeling that success, not feeling it in my body when I woke up in the morning and being excited to go into work and about what, I had on tap for the day. And I really felt like as my business grew, the tasks and jobs that then I was responsible for was not how I wanted to be spending my time. I was not an HR manager. I was, like there were so many things that I wanted to work deeply with people. And the bigger my business got, the less I was actually able to do that. And so I really had to look at, okay, what's going to keep me in the energy that feels good? And so ultimately I did close that down and downsized. And you don't hear scaling down stories very often. That's not, again, what society typically celebrates, but it was like the best decision. I can't tell you, probably once a week, I'm like, oh my gosh, I'm so thrilled with myself for making that choice because I'm what, 2.5 years into that decision, working from home and having scaled down, and my energy is so much better. I get to spend all my time doing the stuff I love and not having to worry about payroll and all of these other things. And so it's really about, I think, ultimately it comes back to trusting myself and trusting that I know what I need and not looking outside of myself to messages or what other people think I should do. It was knowing that, like, no, this is going to feel good for me. And that's good enough reason to make a shift like that. And I think it's paid off dividends.
It's
Yeah.
I was so similar in terms of I had my studio in Lambeth, and again to all outsiders, like most of the group classes were full with wait lists. Like it was very successful. Everyone was thrilled with it. And for me, I just found like I needed to have those big full classes in order to pay all of the bills. And I was getting great, but then no one was progressing, and I wasn't able to address like, oh, this person has had issues with their shoulder for like a year, and that's what I really wanted to focus on was like individuals and trying to
Yeah.
find success that you can't find in a group class with 20, 30 people in it.
Yeah.
And so I was like, I don't want this anymore. And it took a really big leap of faith, and so, so grateful to all the people in my life that are like in my corner, and I could be like, I think I've done this, and not have that judgment of why it's going so well. And instead
Yeah.
me and being like, "You're not doing very well, are you?" And, no, I'm
Yeah.
not. And this is
Yeah,
fun, and
exactly.
this is
And you know what's interesting is when I did make that change, is how many people contacted me saying, "Oh my gosh, I wish I could do the same."
yes.
And that really struck me because, of course, anybody could make that change. And that's obviously what I told them. It's absolutely possible for you. It is not easy to make a change like that. That was, I will always hold decisions made in the name of alignment will be the most challenging. But that doesn't mean you don't do it. And it kind of breaks my heart to think that there are so many people doing the thing that on the outside looks great, but on the inside doesn't feel right. And so, yeah, I think it's a great leadership moment and message to other people of like, hey, this is what's possible. Because yeah, I would never want anyone to stay in something just because it looks or sounds good. You like to tell people at the dinner party, but you hate to get up on Monday morning.
And like your end game can change. Like I don't know who let a 21-year-old open a studio, but they did. And like when I was 21, I thought that's exactly like for all the studios that I worked for, I was like, that's what I want. I want to be running that. And so I did it and it was great. But like my end game then changed. I didn't realize at the time that I wanted to hone in on individual people more instead of that overall community feel. I wanted
Yeah.
individuals. And it took me a little bit of time to figure that out. But I've had several clients like massage therapists, osteos that I've convinced to change to home practices. And I'm like, it is
Yeah.
adjustment. And like, if you like have a partner, like they have to be on board because yes, like Wes needs to make sure that the driveway is shoveled so people don't slip and fall and together on that.
Yeah.
But
Yeah. I think it's
it's
so normal to change. Like that's the other
allowed.
piece
It's
of this
good.
is making sure that as you grow and change, which we all will inevitably do, that you allow that to shift how you show up in the world and your identity and not trying to hold on so tightly, you know, because I think sometimes all we have to do is change and then it's okay again and let ourselves change and we can have so much resistance against that's actually the pain.
Yes, because otherwise I would have peaked at 21.
Right.
If that was like the
Right.
whole life career goal, then at 21, check there, you've done it,
Yeah,
well done. And I don't
precisely.
21.
Yeah.
So you have been so open and honest in sharing your journey with endometriosis. Can you share what some of the initial symptoms were and how you sought out appropriate treatment plan for you?
Yeah, I think like anyone, if anyone who's listening has endometriosis or something, similar where it's, the average time to diagnosis for endo is 8 to 10 years. And that's for a disease that 1 in 9 women and people born with uteruses are ultimately diagnosed with. So this is not a rare condition. This is a very, common 200 million women across the planet have this. And the average time is 8 to 10 years for a proper diagnosis. And if I look back, my symptoms started just before puberty.
Mhm.
So at 12 years old, I didn't know until literally last year. I am now 37. So 25 years later, I did not know until this past year that I didn't get a definitive diagnosis until this past January. But knowing what I know now, so many of my symptoms were gastrointestinal.
Yeah.
I started, at age 12, I started to get, have lots of food sensitivities. Like it honestly felt like nothing was sitting well in my tummy. I did, all these like elimination diets. I had endoscopies, I had colonoscopies, was ultimately, diagnosed with celiac disease, but never really got over those. I, was off gluten and dairy for 25 years. and continuously would have GI symptoms, bloating, alternating constipation, diarrhea. I had to be so careful eating out, like anything that was like really high fat, just like never sat well. So really sort of self-limiting GI issues that, were more recently in the last couple of years, I had a gastroenterologist diagnose me over the phone with IBS and tell me to try yoga, like I was doing this to myself because I was so stressed out, which I knew in my soul I was absolutely not stressed out. I've done so much work to create a life that I love, and I knew stress wasn't a factor. And so I kind of, thank goodness, was able to brush that off. But over the past probably 10 years, sort of I started to have more significant symptoms that maybe it just in my mind were more indicative of endometriosis. So really, really painful cramping around ovulation and around my cycle, sometimes so much so that I couldn't walk. I would get radiating leg pain down my left leg. That realistically, it's funny, as a physical therapist, I probably would have told somebody to use a cane. However, I refused. Classic, do as I say, not as I do. I would get really bad headaches. Prior to my cycle, I had right shoulder blade pain, like searing right shoulder blade pain, but it was once a month, about 2 or 3 days before my cycle. I started, as things, progressed, I started to get bladder symptoms, really painful bladder symptoms. So like I had a right hip. I thought I had a labral tear. I actually had a cortisone injection in it and didn't really help. And I was doing all the physio things that I thought should help, and nothing really changed. A lot of pain with intercourse. We actually like weren't able to have penetrative sex because it was just too painful for me. So like just this like rolling list of symptoms within my body that made me feel like, my gosh, like one thing after another with you, girl.
Yeah.
And truly, I did have a surgery, so I pushed. I literally had to push to get pelvic ultrasounds done. And in 2016, I was told that I had two very large ovarian cysts. They were just going to monitored them, and in 2019, they had become 15 and 12 centimeters.
That's significant.
So, and like I don't have, a very large pelvis, and so that
Yeah.
was taking up a lot of real estate. And so I was told, like, okay, we're gonna remove those. We'll go in and remove them. While we're in there, we will check for endo. And I was seeing, I had been through a litany of gynecologists. I had seen 7 here in London. And at the time, I was seeing the head of, our hospital system's gynecology department. So I trusted that he knew what he was doing. That was in 2020. I had the surgery to remove those. And I remember so vividly him saying, good news, no signs of endo. And thinking, oh, excellent.
Yeah.
So I, recovered from that surgery. It took 3, 4 months. And 6 months later, I was back in his office in more pain than I was prior to that surgery, and was really told, if you don't want to go on birth control, there's nothing I can do. We don't know what's wrong with you. Again, relax was kind of the advice. And I remember getting in my car, and I know so many people with chronic conditions have had this experience. I remember after that appointment getting in my car and just absolutely bawling
Yep.
and like uncontrollably sobbing, because I felt like he did not take the time to understand how this was impacting my life, every aspect of my life, not only my body, but my relationship with my husband, socially, what I was able to do. I couldn't make plans because it felt like every time I made plans, I like wasn't able to, on the day I wasn't feeling up to it. Every aspect of my life was being affected by this. And he was kind of like, I thought that sounds like that sounds hard, but there's nothing I can do. And so I just started on this path of like, no, I'm going to figure this out. I'm very privileged. I am white, I'm cisgender. I have two masters of science degrees. My husband is a doctor. Like, we do live in a medical hub city. Like, there's a lot I have rooting for me. I was like, I got to figure this out. I'm not going to let this guy just brush this off. And so sort of started down this path of trying to find people who could help me. It took years. That was 2020. Well, 2021 was that appointment. And, I had to wait a long time, but I found a doctor who did the proper imaging for endometriosis. And he was not 20 seconds into my scan when he looked at me and he said, "Oh, you have very severe stage 4 endometriosis."
Thank you. That's
And you know what? Like, I think some people might hear that and very understandably, like, have a lot of upset and grief and you know what? I was just so relieved.
yes.
I just like the wash of relief over me in that moment was like, oh, I'm not crazy.
No, thank you. Thank you.
Yeah. And it was just, it's more common that surgeons don't know what they're looking for when it comes to endometriosis. And the training is just not there. The awareness is just not there. And so, yeah, it took me 25 years to get a diagnosis. Ultimately, here in Canada, the wait time for the surgery that I needed was going to be 4 years, which was just like untenable to me. I was off work at that point. Like, my whole life had just really shrunk down to not very much. And again, I have a lot of unearned advantages, and I was able to get surgery in the US, and I'm just like 6 months post-op sitting here today. And all of those symptoms, the GI issues, the hip pain, the shoulder blade pain, the migraines, the bladder pain, my radiating leg pain, all gone. None.
Wild.
Zero. Zero.
So do you have any dietary restrictions still? Or like
So I'm back on dairy, which is like opened up like a whole new world in my life. I'm so excited about it. I will own that I think I have a mental block around gluten.
Yep.
And I did have a diagnosis of celiac disease. So like the surgeon said, like I absolutely try it. I'm like, oh, I'm feeling so good. Why would I put that in jeopardy? And I'm just like, it's been 25 years.
Yeah.
So it's not to say I won't, but I did start with dairy, and dairy has been absolutely fine. And it blows my mind, and it makes me, there is an element of like upset because I know how many other women are dealing with the exact same symptoms as me. And I've shared a lot of my story and a lot of my journey on Instagram, and I've literally had thousands of
Yeah.
women reach out to me. And it's like, how are we all being treated this way? How is this the standard of care? And to see how getting the care I needed, the trajectory of my life is just different now.
Yes.
And, I've talked to women who've had to remortgage their homes in order to get the care they needed. I've talked to women, like, the divorce rate with people with endo is 75%. Like, this is not something we should just be saying like, oh, try birth control. If not, I'm sorry, there's nothing we can do. Like, there absolutely is stuff we can do about it. And the standard of care needs to change. We don't need to change. The standard of care does.
Absolutely. I work with a lot of women, and it's even like I've been on a hormone balancing journey for the last couple of years. And anytime I've gone to a Western medicine professional, and I've gone to some really lovely people who would really like to help,
Yeah.
they just literally don't have any more information for me. They're like,
Mhm.
increase your stress, try birth control, try losing weight. And I'm like, you
Yeah.
have to say those three to people. It's
It's
so
terrifying.
yes. Yes.
And I think the thing that I always hold is, you and I have a level of knowledge that the majority doesn't.
Yes, which is
And so
terrifying.
it is terrifying because, I was told here in London by a separate doctor that the only way to help me was to have a hysterectomy.
Yeah.
And that was actually the only organ that was untouched in my surgery. Nothing needed to be done there. And so just to think how many people and again, my surgery in 2020, I did kind of blindly trust if I could go back, I would not have had that surgery. Those two cysts were glaring signs of endometriosis. I just didn't know any better, and clearly neither did the surgeon. And so, it does break my heart of how much medical gaslighting, how much trauma we all experience in those scenarios. It's not okay. Not okay.
I had gone with like a year's worth of records of me tracking my symptoms of there's something going on there. And the doctor
Yeah.
looked at me and they're like, well, it could be lupus. I'm like, um, so
Okay. Okay.
I literally have it tracks so perfectly every month. It's the same every month. And you want to tell me that you think that that's lupus related?
Oh
For the
boy.
record, I
Oh
do not
boy.
have lupus. That they couldn't even fathom that that would be a hormone issue because no, it's lupus.
Right. I mean, I heard recently that the amount we currently today in 2024 know about women's health is equivalent to the knowledge that the Elizabethans had about the brain. So, what?
So
That's terrifying.
in typical equestrian style, I'm going to relate this because I had a gelding, previously a boy horse, and now I have a mare, and I wanted to learn more about her heat cycles. And
Hmm.
there's no research or information. There's all this information of how fix for non-horse people for like fixing a stallion to a gelding and like making that snip. There's tons of research on how that affects the system.
Yeah,
But there's nothing about of like, oh my God, it's across species. It's literally
yeah,
like reproductive in organs in general. And like if you have a uterus, we don't know what to do with that. It makes
exactly,
me very uncomfortable. We
exactly.
don't know. I was just mind boggled
So
how
wild.
literally across all species, we don't know.
Yeah, yeah, that's wild.
It's
That's wild.
wild. It's wild.
But also, unfortunately, not surprising.
No, I think
Yeah,
that is what made me the most sad is like initially, and my first reaction, I'm like, well, that's kind of funny. And I'm like, no, it's not actually. Like, that's terrifying and really sad and kind
yeah,
of pathetic in our world I'm not even surprised by that. That's really sad
I
that I'm
know.
surprised.
Yeah, yeah.
So I want to talk about having to advocate for yourself in healthcare because I've been doing it since like literally the age of 7. I figured out how to start
Yeah.
doing that. And I truly believe that having to expect almost every conversation to be a fight, it like
Mm.
I know for me that has definitely hardened me over the years of I can go in and just kind of I realize I'm not there to make friends. And I know like being told by someone who's supposed to be held in a really high regard, and there's lovely doctors out there and they don't mean necessarily to
Yeah.
do harm, but it's exhausting having to go in and have to advocate and fight for yourself. How do you
Yeah.
feel that's affected your like mental health, your mentality going into appointments and all of that?
Yeah, I think it's been really interesting, just like you said, to almost watch my own like sort of have witness consciousness of myself and watch myself and how I'm feeling, the day of a medical appointment, sitting in the waiting room. I've been very aware that that has shifted for me over time and has become more of an anxiety producing event than, maybe it would have been 10 years ago. Um, I ultimately, there's been a few things that I have shifted that have made it better. My husband comes to all my appointments now. And I don't know why I didn't think of this before. Honestly, the first appointment that he came with me to was my pre-op appointment. I had my surgery in Atlanta, and that was the first appointment he had ever been with me at. And I remember after, and this sounds so silly, but I remember after being like, "Wow, that was actually really nice and helpful to have you there." And he was like, I ask you every time if you want me to come. And, again, I think I sort of thought because I've worked in healthcare for over 15 years and, I'm highly educated. I sort of felt like I could advocate for myself. But what I didn't realize is like, and maybe you've had this experience too. I think, I definitely have experienced a high level of medical gaslighting and trauma. And I do have a bit of a, outside my window of tolerance response. I can really easily shut down. I can really easily stop listening and start, coming up with my rebuttal and missing things, or being so spun out that I can't even think of the questions I want to ask. And so to have somebody else there who's like able to stay rooted and grounded is so valuable. And so, he's been to a few appointments with me since then. And just to have that person that can advocate for you when you were just, spinning around in your head, or, remember the answers to certain questions has been so, so valuable. And I didn't realize, like, if you don't have somebody that can go with you, if you don't have a family member or friend or a partner, patient advocates exist.
Yep,
You
they
can
really do.
get a patient advocate to sit there with you. You don't have to be in these rooms alone. And I think the other thing that's been really helpful is, it was actually quite, I'll say, eye-opening when I did have surgery in the US, the level of transparency, just because it is a private system that they have to adhere to. Like, I literally have a USB with my 6.5 hour surgery filmed on it. I have about, I don't know, probably 47 color photos of like before and afters, access to all of my records. And prior to that surgery, I had to get all my records from my previous surgery. And there was so much in that surgery that I was not told about.
Mhm.
They had taken 80% of my right ovary and never told me. And so really making sure, if, I more recently had a doctor say that it didn't need something didn't need investigated further. And I just said, can you make sure to document that in my chart?
My favorite
And
line. I do
and
that all the
the
time.
shift, my gosh, the shift after saying that, after just saying, I want you to hold responsibility for this decision you're making, whew, that changed things.
Their
So,
whole demeanor changes. Like, anytime I've been in, and like, I'm now so, so grateful. I have an incredible, like, my nephrologist, my kidney specialist. Like, he's sometimes known in the hospital as, like, other staff are like, oh, you get along with him. I'm like, yes, because he will put his patient first, and he knows
mhm,
I'm coming in saying I'm in pain, that like most people would be on the floor, and I somehow managed to walk myself into the hospital to communicate that I'm in pain.
yeah,
Until then, like, if I went in, there were, I hate to say it, but there were a lot of like older white men who needs to
mhm,
retire. And I would come in and I would say, this doesn't feel right. And as soon as I started to pull out that line of, they'd be like, well, like, we'll monitor it. I'm like, can you please make a note in the chart that I've brought these concerns and you've said it's fine, so that when I come in next week dying, we can look up
right.
like, oh, she had early symptoms, and it changes the two real
Yeah.
results. And they're like, you know what? Let's just do that blood work now. And I'm like, yes,
Yeah, yeah, I thought so. I
yeah,
thought so.
let's go ahead and
Um,
do that. Thank you.
and I don't know. It was so interesting to experience private healthcare. And again,
I've never
that's
had that experience. Like, all of mine has been good and bad. Like, in Canada, there's been a lot of good, but
yeah.
there's been a lot of like not super great too.
Yeah, and I think again, my husband works in that system, and I don't think it's a lack of good people. I think
No.
it is such a byproduct of a system that isn't built to let doctors do what they need to do. There's so many constraints, whether it's how many patients they have to see in a day, whether it's, trying to bring down the cost of every patient. Like there's so many constraints that just make it uh, so challenging to do the right thing, which is like so counterproductive, especially when it comes to literally, if we don't have our health, what do we have? And so yeah, it's been eye-opening, but I think those types of things, having my husband come, asking for that, asking more questions, following up. I always remind myself, like, this is their literal job. It's okay if I call and say, hey, did you send that referral? I can double check things.
Yes.
It is their job. They are in service to me, and that is okay. And so there's no room for people pleasing in that.
No. I think it's so interesting, like you thinking to bring your husband or not thinking to bring your husband, because I don't know if it's like that. Like I'm a strong, independent person. I can
Yeah,
myself. And then I never used to have anxiety going into appointments. I now, with lots of therapy, understand I would just disassociate before I even went.
right.
It's like, oh, I
Yeah.
have anxiety.
Yeah.
No, I just wasn't connected to my body at all. But after my GBS day and being in the hospital for 3, 4 months, going in now is a little more anxiety
Of
riddled for
course.
me. And I am now in a place where I can let myself feel that a little bit. So I asked my
Yeah.
husband to come for the first time ever to an appointment. And he's like, yes, yes, I'll come. And I'm like, okay, thank you. That would be great. And then I
Brilliant.
wanted to like pop into the transplant unit where I spent my like 3, 4 months and just wanted to like
Right.
hide all of them and like, look at me. And I had a full on panic attack walking in.
Yeah.
And it was so eye opening for me because I'm like, if my husband wasn't there, I wouldn't have had a panic attack because I still would have had like my little
Mm,
on, I would have had walls on, like
yeah.
I would have been able to walk in no problem. Like for me, it was just so eye opening of like, oh my God, look how much my nervous system can when you actually have your support person there and like someone else to like
Yeah.
just be that like rock for you. So now I'm like, can you come again? He's like, did it go well? There. Oh yeah.
It actually did. It actually
Like
did. And that's
it didn't
something,
look like it.
yeah, that's something I have definitely taken with me as a practitioner, as a healthcare practitioner myself, is almost operating under the assumption that everybody I meet coming for an appointment does have some level of medical trauma. And I need to be asking, what would have them feel more comfortable, feeling more safe? What do they need in order, to have this be a good experience? I now will name for myself two practitioners that I'm meeting for the first time that I do have medical trauma. And
Yes.
this is what I need in this appointment to have this feel okay and good. And so I want to offer that forward to my patients as well.
That was one of the things I wanted to chat about too, is like how that's changed because like for me, my medical experiences started so young. So I know obviously that changes how I approach people and how we work together. But it's humbling to experience pain as a practitioner who works with people who are in pain and to
Yeah.
have those experiences of even just like rehabbing yourself and like slowly bringing yourself back. I knew you and I had chatted where you're like, this is slower than I thought it was going to be.
Oh my gosh, it felt so slow. Oh gosh. Yeah.
But I think
The
to be able to like to bring that forward like with clients patients like it's like I hear you, I know. And like to actually
yeah.
be able to say I know instead of just like I remember reading in the textbook that this would take a while. It is so different to be able to be like yeah, it took several months for me to actually feel
Right.
like this.
Yeah, I think there's, any time, any experience we undergo personally, I think helps us understand others better, right? But especially an experience with physical pain and recovery, obviously in my line of work as a PT, very valuable. And yeah, I think, it was interesting because I had had that surgery in 2020 that was done laparoscopically. Um, So you just sort of have like these four poke holes in your abdomen after. And my surgery in Atlanta in June, I sort of had the same scars.
Mhm.
And so, forgetting that my surgery in 2020 was 40 minutes and my surgery in Atlanta was 6.5 hours.
Mhm.
I really, sort of looked down and thought, okay, this is going to be the same deal. Right? And the surgeon definitely told me post-op it'll be 6 months. And in my mind, I still told myself 6 weeks. And at 6 weeks, when I couldn't even walk to her mailbox, I was so frustrated.
Yeah.
But also had the level of understanding that like what went on inside was so drastically different. There was literally no organ in my abdomen that was untouched. So there was a lot going on there. But I think, like we talked about, having the understanding of medical gaslighting and its prevalence, I think has definitely helped me as a practitioner. But then also some very like logistical things, like how nice it was for me if I woke up on a given day and was just like not feeling up to it to be able to make an appointment virtual,
Yes.
and being flexible that like I didn't need to be anywhere. And so I'm really making a point of having virtual always on the table.
Yes.
I think rehab and sort of medical vacation is really important. Leading up to my surgery in June, in May, I remember looking at my calendar and feeling like so overwhelmed with the number of appointments I had. And I canceled them all.
Yeah.
And not to say that they wouldn't have been beneficial, but I think if you're somebody who has so many appointments, that can really start to take over your life. It can actually create more stress than help. And so I think I'm so much more apt to, and especially like this time of year, we're recording this in December and people are, stressed with the holidays and have a lot of extra stuff going on, and just having the ability to be like, well, like you don't have to come. Like you will survive. Like maybe you won't progress as much, but you probably won't go back. And like it's okay to take some like holidays from appointments. People with chronic illnesses, I think this is like so, so important to let yourself just live for a little bit. Obviously, everybody's different, but I know I really needed some like healthcare vacations.
Yes. Just like a little bit of grace with your
Yeah.
have a client who I've connected really, really well with. She went through chemo, she had several surgeries, and then she started working with me. But then it works in a school, so she started back to work. And she came in, like, I knew the first week of school, I'm like, no, I'm not going to book you that week. That's absolutely ridiculous.
Yeah.
I was like, let's touch base like end of September. And she walked in and she just looked dead on her feet. And I was
Mm.
like, I don't think this appointment is going to serve you. And like, I think you just need to see what your body needs to be back to work full time, because that's a huge adjustment.
Yeah.
She cried and she's just like, you're the first person to like say that. And like everyone else is
Yeah, to like let it be okay that like, you know
like,
what,
you
as
need to
much
do
as
this, you need to do this. And I'm like, I think you just need to learn how to exist, because this is a lot. And I've been there
yeah.
where I would like guilt myself of like, oh, you should really be working out. I'm like, no, you just had surgery. You just went back to work. Like,
Yeah.
no, it's okay.
And like think of the effects. Like I always just think of the effects of like that guilt
Yes.
on how we feel, right? And I think if, it's sort of sold to us that, having these appointments and doing things that are good for ourselves is what's going to help. And sometimes like the most enlightened thing you can do is do absolutely nothing. And that brings me to like my other thing, which is like less was totally more for me.
Yeah.
I remember actually I was working with a pelvic floor PT and saying to her, like, don't you dare give me anything to do at home. Like we're gonna have this session and then I'm gonna leave. And like I was like at my limit. And so, I think as a PT, sometimes we can get into this mindset that like if we're not giving people something new or different or trying something else, that it's not of value to them. And there was no value going to be had in giving me more to do. And so trusting that that is a conversation to be had with people, what will serve you today,
Yes.
and really letting people check in with themselves. What is it that they need? Because I've definitely learned throughout all of this for myself, like I know my body best. No one is ever going to tell me they know my body better. And so really trusting people and giving them some autonomy, obviously with guidance, but less is definitely more.
And there's no point, like I ask people, like, do you want to come in, do a session here? Are you looking for a program at home? Are you looking for little things to do at home? And like my favorite is when people are honest and they're like, I'm not going to do anything at home. And they feel guilty saying that. I'm like, no, but that's so important for me to know, because then I can shape
It
it
helps.
going to be best for you. And also
Yeah.
know if they are seeing other practitioners and, oh, your massage therapist gave you exercises too, but you're seeing physio and they gave you exercises too. Like, you don't need three cooks in the kitchen. Like,
The
let's,
level of overwhelm,
yeah,
right? With something like that. And then on top of that, the guilt because you're not doing
you're not
everything that
doing
everybody
it.
told you to do and all of this stuff. Like I do think it's so important and great that, that's something you're considering for people, because I just remember how deeply overwhelming it all felt.
So
And I would
much.
never want to pile that on somebody else.
No, we're supposed to be helping.
Yeah.
So as an enthusiastic entrepreneur, I know it's incredibly challenging balancing your business with health and recovery. I know we've touched on this a little bit, but
Yeah.
how did you how did you make those discoveries along the way? How did you feel about trying to balance like the business that you've built versus your health?
Yeah, I wouldn't say I balanced it. I think I was like, I think I said, you know what, my health is priority
Yes.
and everything else needs to go by the wayside.
Yes.
So I stopped practicing PT in it would have been like very early, I think it was the first week of March.
Mhm.
Um, and I stopped coaching sort of mid-May. Um, obviously with the intention of getting back to that at some point, but I really didn't give myself a timeline. I felt like I had no idea what I was about to undergo. And it was a pretty unknown surgery going in, right? A lot of it they found on entry. So I gave myself, I think I went back to coaching. Coaching, I just do on Zoom. I'm sitting, I have a big comfy chair. I went back to coaching in about 4 or 5 weeks post-op. And it was the absolute right thing for me to do,
Yes.
because physically I couldn't do much, but my brain was like so ready to connect with other people. I felt like so trapped in my house. I
Yes.
was so ready to like have conversations and connect, and I knew what my brain was able to still serve and still help. And so I'm so grateful for that role. And I think maybe subconsciously I had put a date on going back to physio in September.
Mhm.
I hadn't told anybody that, but I think I felt this level of responsibility to reach out to people in September, and I ultimately decided not to return. I knew I wasn't ready. I like my body, I physically wasn't ready. I wasn't lifting over 20 pounds, and like most people's legs are 20 pounds, if not more. And I knew I just needed to keep on going slow. I knew that just jumping back into my old life was not the way, was not what was going to serve me and my healing process. And so I did end up seeing one person sort of through the fall, but I have not opened up my practice again. And I truthfully, I don't know what that looks like
Yeah.
yet. And I'm so okay with that. The work I'm doing now is feeling really good, and it allows me the time and the space and the energy to continue doing what I need in order to feel good. And so I'm just not, I will never sacrifice that. And I think that brings me back to sort of how we talked about, anything I do for myself really transmutes itself through my business. And so I know I'm feeling the best I felt since I was like 10 years old, which is wild. And so I'm going to be ruthlessly protective of that moving
Yes,
forward. And I know that that will obviously deeply serve me, but deeply serve everyone that I interact with. And so I guess that is my new set point.
I love that. It's
Yeah.
but finding the pieces. I like when I was in the hospital with GBS, I still taught Zoom clients, and every I know. So yes, I was actually paralyzed. Yes, I was on an IV drip, and yes, I was still using the
But here's the
hospital.
thing. But like that, I would have no judgment of you for that because it's similar
It
to me, where you were
saved
like,
me. It's like
I need something that is not so focused on my health. And
yeah,
I think we can get so much energy from serving others. And that's why returning to my coaching role was so important to
exactly.
me. It's like, yeah, it took me 20 minutes to get downstairs and sit in a chair, and it took me 40 minutes to recover after, but like it was so key to my healing process. So I love that you did that.
But it was in the middle of COVID. I wasn't allowed visitors. I was in a little box room all by myself. The nurses were incredible, but that was my lifeline. Like that was, and like they would put it on
Right.
the door like when I had classes, so like no one would interrupt me. And but they put so much effort into that for me to make it like possible. But I was like, that's how I kept track of the days of the week. That's how I kept track of like
Yeah.
time it is, and I got so much out of it, and the fact that people logged in is just like thank you.
That
But
is amazing. And I think it's also like showing yourself that you have an identity outside
yeah,
of a sick person.
yes,
Yeah.
and
Yeah.
I can't get myself to the bathroom, but I can do this. And
Exactly.
yes,
Yeah.
yeah, awesome.
Love it.
Any other comments, words of wisdom that you would like to share?
Oh
I
gosh.
know it's always so big.
Yeah, I think, if I look back, the thing I think has shown itself time and time again is how much I have gained personally, and I think others gain by like stopping and like tuning into ourselves. I think there's so many outside voices, outside distractions, outside noise, and I just see how I've been served so well by like stopping, listening to myself, trusting my intuition, trusting my body, and letting that be the guide. And anytime I've not done that, it has never taken me where I want to go.
Yep, it's
Yeah.
and I talk to people sometimes and they're like, oh, that sounds so scary to just like pause and think. I'm like, ah, you should explore that. Like,
That that is where the interesting things start to happen.
exactly. If you have that moment of quiet and then that's scary, I'm like, see what happens if you actually like sit in that and see what happens. And I'm not saying it's not scary, but it's I've come to a lot of positive life altering conclusions that way. And
Yeah.
yeah, inner thoughts are scary sometimes, but sometimes you need to listen to the scaries. They're usually right.
Like, I truly think life speaks in whispers, and if you ignore the whispers, you get a 2x4.
Yes.
And so, but like, I truly think it's so important to let yourself hear those whispers and not judge them, and have compassion for them, but let that guide you. Because otherwise life is gonna life is gonna have another way of having you come to the same realization, and it won't be near
Not
as
nearly as
gentle.
pleasant.
Yeah.
Awesome. Thank you so
Brilliant.
much, Emma. I greatly
My
appreciate
pleasure.
the time.